Hello, everyone. Thank you so much for joining us today for a very exciting talk on women's health. As always, we are very grateful that you are taking the time to learn about lifestyle medicine and the importance and just learning information that can help you to offer better treatment to your patients, because at the end of the day, that's what we really care about. We care about offering the best options and the best information to our patients. So thank you so much for joining us. And if you could just pop into the chat and let us know where you're joining in from and what your background is, we'd really love to just get to know you a bit better. If you have any questions during the webinar, then please also feel free to pop those into the chat and Dr. David Glass will answer them at the end. We are also going to be announcing the winners for the free British Society of Lifestyle Medicine conference, and those winners will be announced at the end of the webinar. So please let us know where you're joining us from, and we are going to start the presentation now. I am just going to share my screen. Just give me 1 second. Again, if you have any comments or questions, then please feel free to enter them into the chat.
Good evening, my name is Dave Glass and I will be talking today about lifestyle medicine and women's health. I've been a gynecologist for almost 30 years, but only in the last 2 to 3 years have I realized the importance of lifestyle behaviors on gynecological conditions. Of course, for many years I've been aware of the fact that lifestyle medicine improves conditions like diabetes, atherosclerosis, autoimmune diseases, and so on. But only recently have I seen evidence that this can also apply to conditions relating to gynecology and obstetrics. Of course, there's a wealth of basic research relating to complex physiological processes which can be affected by diet, exercise, and sleep that relate to obstetrics and gynecology. We will only be able to touch the surface of some of these conditions today, and also we will only cover really 2 basic but really common conditions in gynecology. We will also refer to some practical research that has been done, as well as some large population studies that have shown benefits to various lifestyle behaviors in terms of reducing the symptoms and the severity of these conditions. There are a number of basic conditions or basic principles involved in understanding the relevance of lifestyle medicine. First of all is the recognition of the role of lifestyle behaviors in effecting significant improvements on so many different conditions, as I mentioned. But the second one is that there's a recognition of the amazing capacity of the body to heal with the right environment that we provide. So the diet, healthful behaviors can all affect the body's ability to be able to provide healing. And the last thing is that lifestyle medicine does not exclude conventional interventions. So anything that is evidence-based, whether it's pharmacological interventions, surgery, or oncological treatments, is part of our management. But lifestyle medicine just expands what we can offer to patients, and of course it addresses, like the other ones don't, the underlying causes of these conditions. So it is a very important part, in fact it's foundational to our management of all medical conditions, particularly chronic medical conditions. So what will we be covering in today's presentation? First of all, we're going to talk about the role of the microbiota and the microbiome in human health. And this has been found to be such an important aspect of human health in the last 10, 20, 30 years. Just in case you have some misunderstanding like I did for such a long time, the microbiota refers to the numbers and diversity of the microorganisms that inhabit not only the gut but in fact our whole body, and the microbiome is the genetic expression of those microflora relating to human health. Another term that I've only recently come across is the estrobolome, and this is that part of our microflora that is involved in hormonal control, and we'll talk about that a bit later on. Then we will be talking about two different common gynecological conditions and see how lifestyle behaviors can relate to both the causes as well as the management. So polycystic ovarian syndrome is quite a common condition, as is also endometriosis. So those are the two conditions that we will spend most of our time talking about. And then finally we will summarize the various lifestyle behaviors related to women's health issues and then talk about the future. Now let's talk first of all about the role of the microflora in general and gynecological health. We know that having a good microflora, the microbiota, has multiple effects on our body. And a lot of this is through the effect of short-chain fatty acids, which are produced by a whole range of the microorganisms. First of all, we know that a good diet, which is rich in fiber, plant fiber, helps with bowel function and can also help to reduce a lot of bowel diseases, inflammatory bowel disease and irritable bowel syndrome. One of the important factors is the maintenance or the integrity of the intestinal wall and permeability. And this is to a large extent produced by short-chain fatty acids that are produced by healthy bacteria, which maintain the integrity of the wall. When there is dysbiosis, this is where there's a disturbance in a normal healthy microbiome. This allows for increase in intestinal permeability and allows for larger proteins and even bacteria to be able to penetrate the intestinal wall and cause inflammation in the subepithelial layers, but also even enter into the bloodstream and cause major problems around the body. So the immune system, both locally and systemically, can be affected by whether our intestinal flora is healthy or not. But also these short-chain fatty acids have an effect on our appetite and our mass through production of various pathways, and we'll talk about that later as well. And it also has been shown that a healthy microbiome has profound effects on diabetes, hypertension, and hyperlipidemia, and even contribute to mental health. It's been shown that up to 90% of serotonin produced in the body actually comes from the microorganisms in the intestines. Now, what is the role of the microflora in both general as well as gynecological health? Well, we've known for many years that if you take antibiotics for somebody who's using the oral contraceptive pill, the chance of pregnancy is significantly increased. And we know that this is because of reduction in the number of bacteria that are living in the large intestine from antibiotics. But let's just go through that because that's quite important. When we take an estrogen into our bodies, this is absorbed through the intestines into the portal system where it then goes to the liver, and quite a large percentage of the estrogens entering the liver are conjugated and therefore rendered ineffective and these are then eliminated through the bile into the lumen of the intestines. This goes down to the large intestine, where a number of different bacteria are able to reconjugate or reactivate that estrogen, which is then absorbed back again into the portal system, back to the liver, where again a large part of that is then conjugated. But every time it goes back to the liver, some of it gets through into the systemic circulation, where it is then able to be distributed and have its effect on estrogen receptors in various organs in the body. So this is what we refer to as the intrahepatic recirculation of deconjugated estrogens. Now, there are a number of effects of different types of diet on the estrobolome. For instance, we know that a diet that is high in fat, as well as a diet that is high in animal protein, increases deconjugation rates. In other words, it stimulates the bacteria in the intestine that are responsible for deconjugating estrogen, and thus it results in increasing blood estrogen levels. A diet high in dietary fiber absorbs conjugated estrogen. So it binds to the conjugated estrogen and prevents it from access to the bacteria, thus eliminating this in the stools, and this results in a decreased blood estrogen. Also, a diet that is high in dietary fiber increases the gut transit time, and thereby reducing the availability of that estrogen, conjugated estrogen, to those bacteria that live there to again reactivate. So basically, a diet that is high in fat and animal proteins increases estrogen, whereas a diet that is high in plant fibers tends to decrease the circulating estrogen. Now, what are some of the benefits of having a lower blood estrogen as with a predominantly plant-based diet? Well, we know that it results in less endometrial cancer in long-term studies, less breast cancer. It also affects menstrual disorders like dysmenorrhea and menorrhagia. So it also can result in less of these diseases that are caused by chronic estrogen, such as endometriosis and fibromyomas. We know, for instance, that fibromyomas are very uncommon. In fact, maybe even don't occur in prepubertal girls. And even postmenopausal women, the fibroids that do occur at that stage tend to shrink down. They do not grow. So what are some of the other benefits from a plant-based diet? Well, we know that those who are predominantly on a plant-based diet tend to have much less obesity. It doesn't mean it eliminates it completely, but it is much less. There's also less saturated fats in a predominantly plant-based diet. Most of the saturated fats come from palm oils and coconut oils. There's also less sulfur-containing amino acids in a plant-based diet. And this results in less metabolic acidosis, can benefit people with chronic kidney disease. It is also suggested that it can reduce osteoporosis, because an acidosis is often counterbalanced by calcium taken from the bones and then excreted in the kidneys, in the urine. There's also less trimethylamine oxide. Now, in a predominantly animal-based diet, things like choline, carnitine, and betaine are converted by a certain bacteria into trimethylamine, which is then absorbed and delivered to the liver, where it is then converted to trimethylamine oxide. And this substance has been shown to aggravate atherosclerosis and also chronic kidney disease and even diabetes. Another substance which is much more common in people who are eating an animal-based product is advanced glycation end products. These are particularly proteins, but even carbohydrates, that are exposed to high heat, such as in our South African braais and roasting and frying and so on. And these also have been shown to increase the risk of certain chronic diseases. Now, a plant-based diet has many anti-angiogenic compounds. A lot of these are the phytonutrients, and this can help to prevent growth of cancers and tumors. Angiogenesis is an important part of stimulating the growth of these cells. They require plenty of nutrients, these rapidly growing cells, and so they send out angiogenic stimulants. And taking these in our diet can help to reduce that growth. Of course, plant-based diets are rich in antioxidants as well as phytonutrients, which also have multiple benefits. Now, one might ask, what is the greatest nutritional deficiency in Western diets? And a lot of people would say protein, and of course the obligatory source is from animal products. However, in fact, the greatest deficiency in most Western diets is dietary fiber. And there are a number of different types. The most important two branches are soluble fiber and insoluble fiber. Soluble fiber is represented by things like oats bran, which is, when you cook up your oats, you'll notice that it tends to get like a jelly consistency. This is the soluble fiber. And insoluble fiber is found in things like wheat bran, which is more the sort of roughage. Both of these are necessary, and the wider the diversity of different types of fiber, and there are more than 30 that have been identified, so too this results in a wider diversity and wider number of microorganisms which feed off of these different types of fiber. Now, here's a research that was done back in 2010 by Drs. Barnard et al. This was a study that looked at the effect. It was designed to test the hypothesis that a low-fat vegetarian diet reduces dysmenorrhea and premenstrual symptoms by its effect on the serum sex hormone binding globulin concentrations and estrogen activity. Now, sex hormone binding globulin is a protein which binds to both estrogen and testosterone and other hormones and renders their presence in the bloodstream ineffective. So a higher level of sex hormone binding globulin will reduce the availability of the hormones that they are binding to be used by the body. So the lower the sex hormone binding globulin, this means that there is a higher amount of estrogen available to have an effect on various organs. So what they did is it was a randomly assigned crossover design. So everybody was on baseline diet, which is the normal natural diet that they consumed, for 1 month. And then this was followed by 2 months of different types of diet, either the diet under study, which was the vegetarian diet, or else they were kept on their baseline normal diet for 1 month, and then followed by 2 months of a normal diet with supplements. And the supplements were basically just placebo tablets. Okay. So all of the participants either did the 2 months of the low-fat vegetarian diet and then were followed by the 2 months of a normal diet with supplements, or the other way around. Now, originally there were 50 participants, and these were obtained from patients who had real problems with heavy periods and painful periods, and they either were self-referred or else referred by gynecologists in the area. Unfortunately, only 33 of the women completed the study, and the reason they dropped out was things like pregnancy, And another interesting factor is that it was quite difficult to get patients who had been, or participants who had been on the plant-based diet to go off of that, because they found so much benefit, not only in terms of their menstrual symptoms, but also in the terms of general well-being, that they didn't want to go back onto the normal diet. So unfortunately, they were then eliminated from the study. And that speaks to us about, a lot of people say that, well, a plant-based diet is not going to be very popular, and it's difficult for them to do that and to follow up and so on. Now, what they did do with the study is that every participant was given an hour-long session with a dietitian, was taught through a cooking school, and also had sessions to talk about the issues that they were facing every week for the whole duration of the study. Now, of course, the study was fairly short. I mean, each participant was only involved for 2 months with either the low-fat vegetarian diet or the normal diet with supplements. And what were the results? Well, there was statistical significance of both increasing levels of sex hormone binding globulin, as well as dysmenorrhea during the diet phase as opposed to the supplement phase. Let's just look at these bar graphs. You can see there was not much difference in the mass between the two groups, perhaps a tendency towards a lower mass, but I mean in 2 months you can't expect a great deal of change. But notice that the sex hormone binding globulin was considerably higher in the intervention group compared to the baseline and also the supplements. Now you might say that's not a lot, but I mean, remember, this is only for 2 months, and it had significant differences to the symptoms. Flow duration was more or less the same, although there was a decrease in the amount of flow, which is not reported here. But look at the pain duration. You notice that there's a significant drop in the intervention phase compared to those who were on the baseline and supplements. So let's now turn to one of the most common endocrine diseases in the world, and that is polycystic ovarian syndrome. It is thought that the incidence in South Africa is somewhere between 15 and 20% of women. However, it is important to understand that there are differences in different population groups. For instance, it is well known that people from the Asian subcontinent tend to have a higher incidence of both polycystic ovarian syndrome as well as metabolic syndrome. And these two conditions are somewhat similar in many ways. So what are some of the common symptoms? Well, skin is one condition that is affected. The acne, hirsutism, hair loss in the scalp, and pigmentation of the skin is not uncommon. Obesity is quite a common feature. And then, of course, irregularity of periods and infertility is a complication. And then also the high testosterone levels, which relates to the hirsutism. Now, what are the metabolic consequences of PCOS? Well, first of all, there are abnormal hormone levels. So there's a high level of LH, luteinizing hormone, compared to follicle stimulating hormone, FSH. So there's an inversion of the ratio between those two. Normally there's almost double the amount of FSH compared to LH for most of the menstrual cycle. There are also higher androgens, lower sex hormone binding globulin, and then relatively high estrogen, but an absence of progesterone, which of course is only produced once ovulation has occurred. So if there's no ovulation, then you have very little progesterone. And this results in an imbalance in the hormones and an increased risk of extra stimulation of the endometrium and in the long term endometrial cancer. Insulin resistance is not an uncommon condition. Of course, this is a syndrome, so that there are many different manifestations of the condition, but insulin resistance is one of the problems related to PCOS. Often there's increased body fat, as we talked about, and this can result in chronic inflammation. Obesity is a chronic inflammatory process. And then intramyocellular fat, which is usually related to saturated fat, can cause mitochondrial dysfunction and increase the number of reactive oxygen species inside muscle cells, which can interrupt the normal mechanism, the cascade that is involved in allowing insulin to have an effect on glucose absorption. So what are the benefits of a low GI diet? And a low GI diet is best represented by a plant-based diet, unrefined plant-based diet. We know that this can reduce insulin requirements. It works in a number of different ways. First of all, the glucose is tied up with fiber in the intestines, and this then gradually allows for much more gradual absorption of the glucose. We know that it can also result in a reduced LDL, total cholesterol, and triglycerides level, and this has been well shown in many different studies. There's often a reduction in waist circumference, and this is usually associated with less metabolically active fat within the abdominal cavity, as well as decrease in fatty liver disease. There's also a reduction in total testosterone levels, and this is because of higher levels of sex hormone binding globulin. Now, a lot of these are related to a high amount and diversity of dietary fiber, which can affect, of course, the microbiome and microbiota. Increase in dietary fiber means that there is more production of short-chain fatty acids, things like butyrate, propionate, and acetate. And these have multiple effects on the body, as we talked about earlier. But in particular, they can also affect the production of these proteins, GLP-1 and PPY, which are produced in the distal small intestine, and they then increase sense of satiety. Okay, and then also ghrelin, which is produced by the stomach, the small intestine, the pancreas, and the brain, tells us it tells the body to turn off the feeling of appetite, can affect our appetite, and also glucagon from the pancreas, which can also decrease the appetite. Now, one of the most common recommendations these days for both diabetes as well as many other conditions is to go onto a ketogenic diet, and there are benefits. For instance, loss of weight is a common reason for people going onto a ketogenic diet. However, it has been shown that much of the loss of weight, initial loss of weight, is due to dehydration, associated with loss of carbohydrates in the cells. There's also in many patients, and I don't quite understand how this works, but there's an improvement in the serum lipids. But it is also understood that there are some patients who actually, the serum lipids actually deteriorate. Obviously, there's lower insulin because there's much less glucose around to need the insulin because of a low carbohydrate intake. And often there is better hormone levels, and this is usually because losing weight. It is important, though, to realize that there are disadvantages to a ketogenic diet. For instance, there are no long-term studies to show the long-term effects of consuming a ketogenic diet. Most of the studies have been either 8 weeks, 12 weeks, perhaps 6 months, and occasionally up to a year, but no longer than that I am aware of. Another big problem with a ketogenic diet is that because one is cutting out a lot of different sources of fiber in the diet. This can result in a lack in dietary fiber. And as a result of this, one can get gut dysbiosis. Insufficient antioxidants and phytonutrients can also result in high levels of saturated fat in the diet, which, as we have mentioned, as we found in last month's webinar, is a significant cause of insulin resistance and various other conditions as well. What about physical activity in trying to manage PCOS? We know that physical activity increases insulin sensitivity, and there are basically two different types of exercise, both aerobic as well as resistance training are both beneficial in reducing hormones and increasing insulin sensitivity. Adequate sleep is also very important. We know that sleep deprivation increases insulin resistance, obesity, and type 2 diabetes. And this usually works through centrally regulated autonomic pathways. We know that lack of sleep can also cause changes in the ghrelin and leptin secretion, and this tends to promote obesity. Dysbiosis can result in a leaky gut, and this causes lipoprotein saccharides mediated inflammation. And then melatonin has an effect on PCOS as well. It can influence ovarian sex steroid production, and in fact melatonin in the ovaries is a strong free radical scavenger, which can also have effects on ovulation. So this is beneficial there. Now, metformin is commonly used in treating patients with PCOS, and I have very often used it, and sometimes with good success. But it's important to understand that chronic use of metformin can result in B12 deficiency, and here is an illustration that shows that it has effect on the stomach, the gastric parietal cells, reducing intrinsic factor which helps the absorption of B12. It can also affect the intestinal motility. It can also affect the intestinal villi and the enterocytes in the distal ileum, which interferes with B12 absorption, and can also affect the small intestine and enterohepatic circulation of vitamin B12. So it's important when a patient is put onto metformin for any length of time, both for management of diabetes as well as for PCOS, to give them supplements, and possibly the best would be to give an intramuscular supplement. But obviously one just needs to monitor the B12 levels in the blood as well. A number of other supplements have been shown to be beneficial. PCOS is benefited from vitamin D, which increases the insulin synthesis. And release. It also increases insulin receptor expression, influences carbohydrate metabolism. So this is all very important for patients with insulin resistance, and of course diabetic patients as well. Vitamin D inhibits synthesis of pro-inflammatory cytokines and reducing systemic inflammation. Other supplements that are beneficial are, particularly the most important, are magnesium and omega-3, but also zinc, calcium, selenium, and omega-3. Now, another medication that is often used for PCOS is inositol. And I often had medical reps coming around to talk to me about inositol and the benefits in trying to regularize the metabolism or the ovulation. Inositols belong to the vitamin B complex group, and they are often synthesized in the body. The most important ones are myo-inositol and D-chiroinositol. But as it is also found in most of the foods that we eat, particularly whole foods. So we find it in free-range meat and eggs, but we also find it in fruit, in vegetables, in whole unrefined grains, and in nuts and seeds. And of course, all of these are also very important sources of antioxidants and phytochemicals. So not only do they benefit in providing inositol, but they also have many other benefits as well in terms of general health. Now, it has been found that, as we talked about, dietary fiber and magnesium is quite important. So if we have a low dietary intake of fiber and magnesium, this causes increased insulin resistance as well as hyperandrogenism. Now, studies have shown that there's no relationship between calorie intake between matched PCOS and non-PCOS individuals with the same body mass index. So the most important factor that aggravates PCOS is soluble fiber, because this causes a lower postprandial glucose response. And this results in increased insulin sensitivity. So insoluble fiber and soluble fiber both have benefits. Insoluble increases insulin sensitivity, and soluble fiber reduces the glucose response. Now, as I said before, there's a lot of correlation between type 2 diabetes mellitus and PCOS. And the way that you often treat diabetes with lifestyle management, as we heard last month, is by reducing the saturated fat intake, by increasing the amount of unrefined carbohydrates, and reducing fructose, which is just plain sugar basically, and then also increasing the amount of dietary fiber. Let's now look at endometriosis. This, in most articles about endometriosis, you'll find that the incidence is around about 5 to 10%. But these are patients who have been diagnosed through invasive means. And there are probably at least another 5% who have not had a laparoscopy who are being affected. So it's estimated that the incidence is more around 10 to 15% of reproductive age women. Now, there are many postulations of causes, and this slide as well as the next one will talk about some of those. One of them, and this is a review study that was written up by Zizzoli and published earlier this year from Italy. One thought is that there is bacterial contamination of these retrograde endometrial deposits in the peritoneal cavity and on the organs in the pelvis. And this causes immune activation. There's also a strong link between bowel problems like irritable bowel syndrome and inflammatory bowel disease and endometriosis. And it is thought that there is a cytokine impaired gut function which can also affect cytokine cascades in other parts of the body as well. There's also an altered estrogen metabolism and signaling, and commonly there is dysbiosis resulting from a lack of fiber in the diet. And also not only dysbiosis in the bowel, but also dysbiosis in the genital tract. And this can result in disrupted normal immune function, elevated pro-inflammatory cytokines, compromised immunosurveillance, and altered immune cell profiles. And there's a huge amount of information in this article, and I would strongly advise those who are interested to look it up and get that information. Traditionally, the hypothesis was that endometriosis is caused by retrograde menstruation through the tubes into the pelvic cavity, and then attachment onto the pelvic peritoneum and visceral peritoneum. We know that these implants respond to estrogen, particularly the beta receptor estrogens, and this results in, and there seems to be an increasing evidence that it may in fact be an autoimmune disease for those 5 mentioned reasons. We also spoke about dysbiosis of the genital tract, and there's a high incidence of bacterial vaginosis amongst people who suffer from endometriosis. There's also some thought that there may be dysfunctional dysbiosis of the endometrium itself, and this is something that's only recently been investigated. Most people thought that the uterus was sterile, but in fact it's been found that there are bacteria that inhabit the endometrium, and that this might have some relevance to fertility. And a disruption in this, particularly the presence of E. coli, can cause increase in lipopolysaccharides, which can cause peritoneal inflammation. Now let's look at various dietary factors that influence endometriosis. We'll first start off with dietary fat. It's been shown that an intake of palmitic acid, which is a short-chain fatty acid obtained from animal products, and trans fats, also very often from animal products, can increase the incidence of endometriosis. Also, omega-3 fatty acids are associated with a lower incidence of endometriosis. And many commonly used foods these days, and cooking oils and so on, are very rich in omega-6. The ideal balance is a 1-to-1 ratio between omega-3 and omega-6. But with modern Western foods, that can rise to 20 times more omega-6 compared to omega-3, and this is thought to affect inflammation. A diet that is lower in fat and higher in dietary fiber has been shown to reduce circulating estrogens by up to 25%. There's also some concern about the levels of estrogens that are ingested in animal products, both dairy and meat. And we know that most cows that we get our milk from are either pregnant or else they have recently been pregnant, and so therefore there are high levels of estrogens in the milk. Also, estrogen is used as a growth stimulator in animals that are being prepared for slaughter. Now, what about meat intake? One of the long-term studies is the Nurses' Health Study, which has been going on, the NHS2 has been going on since 1989, and they are looking at approximately 120,000 nurses over this period of time. It's one of the best population studies ever been done, run by Harvard University, and they monitor the diets of the individuals on a regular basis to see if there's been any change. And what they found that those who have 2 servings or more of meat per day have a 56% higher risk compared to those who have less than 1 serving per week. Also, we know that showed that there was also an increase in risk with poultry, but much lower than with red meat. And then an Italian study showed that there was a higher risk with beef, red meat, and ham. And we think that this is due to the fact that red meat may promote expression of pro-inflammatory markers. Now, what about plant-based foods? A study that was done by, in fact not a study, a review article that was written by Barnard and published this year, showed that there are a number of benefits from a plant-based diet in endometriosis. One of them, of course, is dietary fiber. We've talked a lot about that, which reduces circulating estrogen concentrations. And then also, plant-based diet is rich in polyphenols and vitamin C and E, which are antioxidants. Polyphenols are often anti-inflammatory. And vitamin D, which is obtained from either sunshine or can also be obtained in plant diets from mushrooms, has anti-inflammatory activity. but one would have to monitor the levels of vitamin D in the blood and perhaps give supplements if necessary. But another interesting food substance is seaweed. And this has been found to have quite potent estrogen modulating activity. And in fact, women who eat seaweed on a regular basis, as in China and the Far East, often have less problems with endometriosis and other estrogen-dependent conditions. So what are some of the changes that can bring about improvements in endometriosis? The ones that are most beneficial are increasing the plant-based foods, cutting out highly refined foods, cutting out dairy and gluten was beneficial for some people, but generally overall their health was improved by going onto a plant-based diet. Other beneficial behaviors include regular exercise, as we spoke about, stress control through various modes, and then avoiding estrogen products in the environment. And this is through things like parabens, which are preservatives in food and cosmetics, and petrochemical toxins. Some toxins are found in pesticides, in plastics, and even personal hygiene products. These are called endocrine disrupting chemicals, and they may have significant effect on estrogen-dependent conditions like breast cancer, fertility, and menstrual disorders. So finally, in summary, excessive estrogens can contribute to many of the diseases that affect women's health, things like breast cancer, endometrial cancer, ovarian cancer, endometriosis, menorrhagia, dysmenorrhea, and polycystic ovarian syndrome. And the estrobolome, that part of the microflora that is responsible for control of or regulating estrogen, can be affected by our diet and by our lifestyle behaviors. What is important is that a high fiber diet tends to reduce excess estrogen levels, and a diet that is high in animal products and fat, particularly saturated fat, tends to increase estrogen blood levels. So a plant-based diet can improve the gut and vaginal microflora, provide antioxidants and phytochemicals, which can reduce inflammation and abnormal angiogenesis. And by the way, angiogenesis also affects the growth of endometriosis. And then, of course, exercise and stress reduction can contribute to overall well-being. So we can see that there's a lot that one can do, and what is important is to do a lot more research. We're only just touching the surface, but further research can show how these benefits can be interpreted in terms of reduction of symptoms and maybe even in prevention of these conditions in the first place. Thank you for your attention. These are 2 pages of references, and if you would like to obtain those references, or if you have any personal questions or questions relating to our presentation, I'll be more than happy to discuss these with you. This is my email address. Thank you so much.
Wonderful. Thank you so much for that presentation, Dr. Glass. I must apologize for not properly introducing you at the beginning. Dr. David Glass is our chairperson of SALMA, and so there really isn't a better person to be speaking to us about women's health, which is so important for about half of the population in South Africa. Dr. Glass qualified with his MD-CHB from UCT in 1975, and he worked for many years at the Maluti Adventist Hospital in Lesotho before going on to qualify as an obstetric consultant. Thereafter, he moved into private practice from 1994 to 2022 and became interested in lifestyle medicine and received his diploma in 2020 and then joined SALMA as our chairperson. And I hope that something that everyone is picking up on throughout these webinars is that the principles of lifestyle medicine, which include a whole food plant-based diet, regular exercise, stress management, quality sleep, social connections, and avoiding risky substances really are key factors for basically every medical condition. So you don't need to now start prescribing one diet for one person with hypertension, one exercise program for someone with diabetes, which is different to someone with endometriosis. But really, these principles can be applied throughout all of our populations. So if you can just put any questions that you have for Dr. Glass in the chat, that would be wonderful. It can be about topics that he spoke about or anything else related to women's health. And it's great to see everyone that's joined us so far. So Dr. Glass, while we're waiting for a few questions, let me just ask you about some of the success stories that you have personally seen in your practice and your time practicing as an obstetrician and gynecologist. Have you seen any women that have personally improved their health dramatically through changing their diet and starting to exercise more? Any stories that you would like to share with us?
Well, as I said, I've only recently realized the impact of lifestyle practices on gynecology. And obviously, we saw patients that had many other diseases like diabetes and hypertension as part of the normal consultation. And certainly with those conditions, both with diabetes as well as with hypertension, with autoimmune diseases, we saw dramatic improvements in those symptoms. And even in the necessity to be able to put patients onto treatment. As far as infertility is concerned, losing weight and reducing exposure to some of these EDCs can certainly have an impact on fertility. So that was something that I discovered. But if I knew what I know now when I was practicing gynecology, I'm sure we would have done a lot more as well. So unfortunately, knowledge improves as we learn more about all these different factors. By the way, on the advertisement, there was talk about, there was mention that I was going to be talking about breast cancer as well. And I would like to refer you to this book. I think this is almost the Bible of understanding breast cancer and breast diseases. It's called Breasts, an Owner's Manual by Dr. Christy Funk, who read over 3,000 articles in the preparation of this book, and her whole attitude towards diet and lifestyle behaviors changed as a result of her research. And she's now a very strong proponent of the 6 principles of lifestyle medicine in managing breast disease as well as breast cancer. She does a lot of breast surgery. She's also involved in oncology, so she's not denying the role that all of these things have, but that it's much better also to just address the underlying causes of so many of these diseases as well.
Wonderful. And even though you didn't necessarily have all of this knowledge for your patients, you're now sharing it with all of us so that we can impact our patients' lives. So yes, you're definitely still having a massive impact. And we thank you for all of the knowledge and wisdom that you've shared with us today.
Yeah. And please let me know if you would like copies of the references, because there's just such a lot of information that I couldn't cover all of that in our presentation today.
Absolutely. Women's health is a huge topic, but you covered some of the most important conditions and the ones that we don't necessarily know too much about. So thank you for that. Great. So if there aren't any further questions, then I am just going to announce our winners for the British Society of Lifestyle Medicine Conference free virtual tickets. We did manage to secure 3 tickets for SOLMA members. And so those 3 tickets are going to be awarded to Megan Michaud, Kedibone Golele, and Tobekile Stepano. I hope I've said those names correctly. Congratulations, and we really hope that you will learn a lot through this conference later in September, and we will be in contact with each of you personally via email to share how you can access that. So thank you everyone so much for joining us. I hope that you learned something about women's health, and we are looking forward to seeing you at our next September webinar. Hope you all have a wonderful weekend.